Back, Mr. Secretary, thanks to the work of the Biden team, done an outstanding job. Americans emerged from the pandemic with the best economy in decades. The pandemic opened our eyes to the titanic need of skilled nursing. So I welcome the President's bold goal to remake our nation's 15,000 nursing homes. And I'm damn angry when I look at the results. This is a $130 billion industry. Wall Street's control over nursing homes grows with risks and abuses. Problems in our nursing homes have been ignored for too long. We need transparency for tax dollars going into big companies, and we must hold bad actors accountable when they provide substandard care for our seniors. A lot of statistics come out of these last 2.5 years, three years. I'm not going to go into too many statistics that I've done that before. Private equity firms, they're having a song and a dance. And you wonder why so many nursing homes are closing. You can't provide service unless you pay the help. You cannot provide service if the help is not up to the job. You got to pay for that. You get what you pay for. And private equity gets what they pay for. So we need transparency. 1 year into the White House initiative, what has this administration done to increase transparency of ownership so we could figure out who owns the darn place and management of our skilled nursing facilities? What's happened in 1 year?
Congressman,
tell me that in 2 sentences.
First, thank you for your advocacy in this area. We have, for the first time, as far as I can remember, required the disclosure of ownership interest in these facilities, because we know that a shell game is often played with regard to who actually handles them. And probably something which you didn't quite say as explicitly is that oftentimes when ownership goes into the hands of a Wall Street firm, they're in there for the money, and so what they do is they extract assets and they oftentimes leave a shell. And the folks who are needing care are the ones who suffer as a result of having less than ideal services. We're also moving forward on the idea of having minimum staffing levels so that regardless of who purchases that facility, you can't go below a certain level.
Excuse me, Mr. Secretary. You've been looking at that for years. Your administration, the previous administration, the administration before that, the administration before that. What have you done? Want me to give you a list in New Jersey?
Yeah, I can't speak for the previous administration, but I can tell you we're in the process of coming out with the rule that will require minimum staffing levels. That's more than I've seen any administration do.
And you're going to work this out with the equity firms?
We don't need to work that out with any equity firm. We get to do that based on a rule that's based on the authorities you gave us.
To your health.
Thank you.
I yield.